I am Dr. Donald Jolly Gabriel, and I'm here to talk about hyperbaric oxygen. Hyperbaric, what does that mean, hyper? Well, hyper means kind of higher than normal, and baric has to do with atmospheric pressure. And so what we're talking about today is oxygen under pressure. I want to remind everybody that when a gas is put under pressure, it will dissolve into whatever liquid is present in that environment. And whatever liquid is present, for example, at the Coca-Cola bottling company in bottles, there will be pressure exerted on a gas called carbon dioxide. And that pressure will cause the carbon dioxide to dissolve and put the fizz in the Coke. In a hyperbaric chamber, what we do is we apply pressure to oxygen, pure 100% oxygen, and that causes the oxygen to dissolve into the blood of whoever is getting the treatment. And oxygen is actually has been declared a drug by the FDA because it has healing elements. It is an incredibly healing gas, and it's dosable. Anything that is a drug has to be dosable. So if you can dose oxygen at a much higher level, which you can by applying pressure, wherever there is pressure in an environment, that pressure will cause whatever gases are in the environment to dissolve into the liquid. That's how we get 100% oxygen through use of a hyperbaric chamber to dissolve into a patient's blood. Oxygen is absolutely healing. We can very easily tell most patients that they'll heal in about half the time if they do hyperbaric oxygenation. We utilize a chamber, a well-designed chamber that's very comfortable for the patient. The patient is put in the chamber for about an hour and breathes 100% oxygen, and healing of almost anything will occur in about half the time. The normal healing for something may take, say, a month, and we can be pretty comfortable in saying we probably can get you finished and back to work or back to being an actress or an actor or whatever in about half the time, and that's a marvelous thing. Oxygen is the most important thing that our body uses. Without it, we will have dead bodies within seconds, not very many seconds. So oxygen then has to be respected as the most necessary element that we use for our bodies to stay alive, active, healthy, and healing. And that's what we use oxygen for. And hyperbaric oxygen is concentrating the level of oxygen to a degree that is very, very high, very high. And to the extent that we're able to dissolve dissolved oxygen into the blood, the healing will be accelerated dramatically. And that's a little bit about hyperbaric oxygen and what oxygen does. Oxygen is a very important thing, as you all know. If we don't breathe for maybe 30 seconds or so, we're going to feel the intensity and fear and anxiety that we might pass out. And that's because oxygen is so important. Now, how do we utilize oxygen in a hyperbaric chamber? We have to put a person in a sealed chamber, a beautifully designed chamber. The patients in the chamber are able to utilize a entertainment system, which is composed of stereo if they'd like to just listen to music, or TV type things with movies and things, or they can watch whatever CDs or DVDs they bring so that they can have whatever entertainment they're used to. And they're in the chamber for about an hour, and someone can sit and look at them and make them feel good and understand that they're together, they're linked together, they're not separated and isolated from anybody else. And the chamber area is usually pretty busy, so they're not alone in there, and they're not at all feeling destitute and scared and frightened. And also, we have a very interesting situation with cancer. Cancer cells are cells that divide quite rapidly, and it appears now through some research that's been done that hyperbaric oxygenation will help to reduce the level at which cancer cells replicate and possibly even cause them to diminish. And that doesn't mean that it'll wipe out cancer, it doesn't mean it's gonna cure cancer, but it does make it an adjunctive, a helping therapy for whatever else you're doing to assist the body in battling the cancer. And so we utilize that also when we treat cancer patients. Hyperbaric oxygen is prescribed generally. Dr. Keneally loves hyperbaric oxygenation because she knows how powerful it is, and our other doctors utilize hyperbaric oxygen, Dr. Beta, Dr. Shannon, Dr. Schaefer, Dr. Rodney, and all of them really recognize the importance of oxygen. And we know that in the chamber we can elevate the level of oxygen anywhere from 400 to 500% very easily. And if in a dire circumstance, such as the flesh-eating bacteria, we can generally get about 800 to 900% higher level of oxygen concentration in the blood, which facilitates the healing and helps the bacterial replication to lower dramatically. I am so pleased to be able to talk a little bit about hyperbaric oxygenation to you, and I'm hoping that someday we could have a program where we could have questions and answers, because I think that when we talk about hyperbaric oxygen, we create an awful lot of questions, and I would like to be able to have a lot of those questions so that we can deliberate a bit and talk about answers.
Do you guys have any questions?
Any questions, anybody at all?
Yes. Can one benefit in one session, or do you have, is it always a series of sessions?
Well, benefit is a wonderful word, and of course you can, because the level of oxygen that you receive in the hyperbaric chamber is so dramatically high that it certainly will do some good. Will it heal something that requires time as well? Not in one treatment, not at all in one treatment. But is it a good thing? Yes, absolutely it's a good thing. And also, learning how to breathe a little bit better is also good, because we are pretty much shallow breathers. And if we increase the level at which we exhale and increase the level at which we inhale, we are going to be utilizing probably 40 to 50% more oxygen. And actually we could build that up to probably about 70%. And an example would be breathing out like, and then all the way in, and all the way out, comfortably, not like a, not necessary to do that, but it is necessary to increase the volume at which you exhale so you can make room for the air. And remember that air is only 21% oxygen. So we're getting oxygen enough to keep us alive and to promote a certain level of healing. But oxygen is such a healing, magnificent gas that if you use 100% and you increase the dissolvability ratio, you can do wonders. I used to be very excited when I was much younger and first started in hyperbarics, when I would be able to tell someone, you know, especially the athletes, the big athletes that earn lots and lots of money, and they're always worried about not being able to make money because they're not able to play the game. And I tell them, you know what? You will be able to get back in the game in half the time. You come to the chamber every day, and I'll have you back in that game in half the time. And they start thinking dollars. Oh yeah, let's go. I want to go right now. See, so that's a very interesting phenomenon that occurs. Any other questions?
Can it help towards reducing inflammation, if there's any inflammation in the body?
Inflammation, hyperbarics is one of the most incredible things for inflammation. The pressure in the chamber helps, and the pure oxygen increases the metabolic rate, and yes, it absolutely is helpful for inflammation. No question about it. Anything else?
One question from Facebook Live named Pat asks, what do you do in situations where a person is claustrophobic?
Well, if a person is claustrophobic, we take a lot of time and effort in helping them get used to the chamber. For example, we might put someone in the chamber, leave the door open for a while, put a movie in, let them watch. The husband, wife, child, friend, or staff member can sit right here, a foot or so away from the patient. The patient has full view. The entire chamber is not closed. It is made of glass that's about that thick, and so there's vision everywhere, and the person can look out, and their husband, wife, children can sit around and watch them and wave at them and talk to them on the microphone if they need to, and they can be watching a movie as well to take their mind off of all of that. So we do everything we can to make them comfortable, and usually the first treatment is the most challenging, but then afterwards people crawl in and get that, and once they realize it's helping them, the fear and anxiety is all gone. Oh yeah, and also our extension number at the Hyperbaric department is 1904. If anyone wants to call it within the medical center here, it's extension 1904, and the entire phone number is 680-1904, and the area code is 949. So if anybody wants to call us, we would be happy to talk to you about hyperbarics and try to explain to you what it is. And coming to have a tour is absolutely wonderful. You do need, if you do hyperbarics, a prescription from your doctor. Ironically, hyperbaric oxygen has been declared a drug by the FDA. That's why you need a prescription for it. And the reason it's declared a drug is because it falls under the category of something that is dosable. You know, aspirin is dosable, antibiotics, all drugs are dosable. They do different things, handle different problems at different doses. Well, so does hyperbarics. If you have a certain problem, you might need a small dose which requires very little pressure. If you have something like the flesh-eating bacteria, you need to go under a lot of pressure. So that's the other extreme. And that's the way it is. And children can go in the hyperbaric chambers. We've even had very, very small children from time to time. We even had a baby, and I am convinced we saved that baby's life. And the baby went in the hyperbaric chamber with his mother holding it, and it had oxygen deprivation, and it was in pretty bad shape. And the baby had, I believe, 12 treatments. Little problem is you get a little bit of ear problems, like when you're flying in an airplane, and a baby doesn't understand that, so the baby screams and cries a little bit. But that's the worst that happens in the chamber with the babies. Anything else?
You mentioned that it's good for athletes. What type of repairs usually happen?
Well,
like it's an injury.
I tell you that oxygen is so important for healing, that higher levels of oxygen decrease healing time. So when you're in the chamber at, say, 2 atmospheres of pressure, I can pretty much comfortably say, especially to a plastic surgery patient, if you do nothing but go home now, you may have to hide for a month, because if you go out, you'll scare everybody. But if you do hyperbaric therapy on a daily basis for maybe 10 or 12 treatments, my prediction is most always you will be able to heal in 1/2 the time. And that's pretty, especially for ladies with plastic surgery.
But that includes sprained muscles.
That's what, yeah, like
ligaments.
this, and so
Yeah, and the
sprained ankle or
athletic
ligament
injuries,
or-
all of those. Yeah.
Okay.
Yeah, about half the time. And of course, especially the NFL players, years ago when we first started treating them, they were very anxious to know why they had to do this. And of course, I equated it to money. I said, you know, you figure out how much money you're losing every day, and we'll have you back in the chamber in half the time. And I remember one of a big guy, I'm not going to say his name, one of the biggest entertainers for sports, and he said, put me in there right now, damn it. And so he was in there in 5 minutes, and he came every day for about 12 days, and problem solved. And he was supposed to be on the bench for a month. You know, on the bench means not in the game. So he was very happy.
Nice.
Yep. Any other questions, comments? Okay, yes.
When the oxygen is applied to the blood, I take it that's how it works. Because
Yes,
of the
yes,
pressure.
oxygen is dissolved directly into the blood because of the pressure in the chamber, And obviously, the pressure is going to influence the entire body. And when you're breathing air, you're only breathing 21% oxygen. When you're in the chamber, you're breathing 100% oxygen. So man, you are so full of oxygen that healing is just going to be magnificent in terms of timing. Yeah.
But in terms of the excess oxygen which your body is taking now, after using the chamber, is there any side effect or repercussion from that?
Well, the repercussions absolutely are all positive.
That's
They're
good.
positive repercussions. They're repercussions that are going to cause the healing mechanism to be activated by the level of oxygen in the blood. So probably 4 hours or so from the time you get out of the chamber, your body is dissipating this oxygen and you're getting some benefit from it for 3 to 4 hours. And that too depends on your breathing level, because every time you exhale, you are exhaling carbon dioxide and you're taking in oxygen, but only 21% in the air.
So should other treatments be done after those 4 hours, or within those 4 hours?
You know
would
what?
be more helpful?
Absolutely, it depends on what we're dealing with. If we're dealing with a sports injury, there are certain things that they want to do, certain massage to stimulate the massage, to stimulate the blood flow and the area that is massaged, and that is very effective, especially after you get out of the chamber and your body is fully oxygenated. That will probably, I would say, reduce healing time by an extra 10 or 15%, which is very useful, especially to an athlete who's getting money, because they equate everything to the money.
Yeah.
What about like protocols here, specifically some of the IVs, like vitamin C?
Yeah, the utilization of hyperbaric oxygen will accelerate the effectiveness of many other therapies. It will accelerate the effectiveness of many other therapies, and used in conjunction with vitamin C can be very helpful, especially in the detoxification mode, because we develop all kinds of poisons in our body, you know. Just sometimes what we're eating, the waste products in the blood, those are all not really good for our body. So the faster we can get rid of them, the better off we are. And the hyperbaric chamber will help accelerate those things in terms of leaving the body, which is a very good thing. And the same thing with working out. You know how when you work out a lot, how your muscles ache and hurt? That's because you're rushing a lot of toxins to them. And this is going to help to alleviate that. It's not magic. It's not if you go in for 10 or 15 minutes is it going to go away, but it's going to accelerate the level of dissipation that will happen anyway.
That's what you don't do.
Pardon me?
Which is why you don't do chemo. Normal chemo.
Oh, chemotherapy, yeah. Using hyperbarics with chemotherapy can accelerate the effectiveness of the chemo, can more importantly, I think, generate a healing mechanism in the body that's conducive to what you're trying to do without having to pay a whole lot of attention to the fact that you're doing chemo or you're doing this or you're doing that, because the hyperbaric therapy is going to accelerate the body's ability to detoxify and also to begin a healing process. So you have two different things you're doing that certainly are going to affect each other in a positive way. That makes sense? Yeah. And then you know, you have to do what you have to do to detoxify. You gotta watch out what you're drinking and what you're eating, and the whole thing about water. Water is extremely important. And we all ought to know that right now. We need to drink enough water every day. And one of the great researchers on water, Dr. Magella, was making a recommendation that we all should have a minimum of 1/2 ounce a day per pound of body weight. So if I weigh 200 pounds, I need to be drinking about 100 ounces of water a day, dispersed throughout the day, not all at once, obviously, but morning, early afternoon, mid-afternoon, late afternoon, and not too soon before you go to bed, or you won't sleep very well. You could be up doing something else. Okay, yes.
So there is another treatment called ozone therapy.
Ozone therapy.
So would it be, how much difference?
They're
would there be?
complementary. They're distinctly different, but they're complementary. Ozone therapy is an oxygenating gas, and it will obviously help to create a higher level of oxygen in your body. And pure 100% oxygen in a hyperbaric environment is going to force oxygen to dissolve into the liquid blood. So you're hitting it, but you don't really need that. It can be helpful in some very severe cases, but more often than not, it wouldn't be necessary to use both of them. But better if you have a real serious problem, sure, absolutely. Anything else? Sure.
I wondered, I heard somewhere, somebody told me that oxygen can help the formation of the blood supply for tumors. Is that something?
Say
is
it
true?
again.
That oxygen can help create the blood supply for tumors.
Oh, you mean in other words, it will feed the tumors?
Yeah.
Well, that could be happening in some cases, but more often than not, it's not going to. And what really is important to remember is what other things are they doing for tumor reduction? Because you're not going to do just one therapy. You're going to do complementary therapies. And the physicians that are treating you are going to be familiar with the type of tumor, whether they're oxygen eaters or whether they're oxygen haters. And you sort of have to know what you're doing well in order to make it efficient and healthy.
So would you know if sarcoma is something that is better with oxygen or without?
I know that some patients are treated who have sarcoma.
Mm-hmm.
I don't know, however, the other conditions that have gone along with it. So I'm not sure, you know, I have to look at you have to isolate a situation and then see what is going on with that before you could make a judgment like that. Okay? Anything else?
I guess along those lines, if you're feeding things that you don't want to feed, sometimes, like would parasites, do you know if it would help or hinder?
Most parasites probably are going to be okay with hyperbarics. There may be some oxygen lovers, and there are, but not many. And we would want to research before, in fact, the doctor who writes the prescription should be the one that collaborates. And I call doctors occasionally, I don't have to do it very often, but once in a while, physicians that wrote a prescription, and talk to them and try to find out what we're fighting.
Okay.
Most of the time we already know anyway, but if we don't, if it's some kind of wild infection or infestation, then I would want to know what's going on so that we don't feed anything.
Right.
Yeah, but it's very rare. That's very rare. Yeah. Okay? Are we all ready for our examination? We'll
As long as it's open book.
we all have to get A's or we're going to be in big trouble.
I have been under the chamber as well.
Okay.
I've done it.
That's great.
Yeah.
Would you so you know what it's like in there? And,
Yeah.
and do you watch movies when you're
Yeah.
in there? Good,
Yeah.
good.
The first time was a bit scary, but the second time was fun.
And you can bring your own DVD movies as well, if you have your own favorite movies. So that's a good thing. Yeah. And you can have somebody there sit there watch you. You know, if you're not comfortable and you want your husband or your wife or your mother or father or whatever, they're welcome to be right there. And you can learn sign language.
Is there a maximum amount of time to be in the chamber, or 60 minutes, 90 minutes?
I would think
more than enough?
that an hour and a half treatment is long enough, unless you have a very, very highly toxic situation. and you have to detoxify and you're doing other things to detoxify, then you might stay in a little bit longer, but not much. It's more effective, I think, to be able to go in for the hour treatment and then go out and do some other things like fully hydrate and get rid of, you know, you want to create a lot of urine so you can get rid of that part of the waste, and then drink more water so that you can start that thing over again, and then you do it again and again, maybe 2 times, 3 times in a 24-hour period. I think that can be very effective as well.
Sorry, one more. Is there a difference in having shorter oxygen, portable oxygen therapies at home, as compared to having a longer session in the chamber?
Well, remember that 21% oxygen in the air. When you're breathing 100% oxygen in a tank, that's fine, but you're getting 100% oxygen, you're getting the benefit of 100% oxygen, but it's not dissolving in the blood anywhere near what being in the chamber would, nowhere near at all. But it's much better, especially if you have oxygen deprivation and your breathing is affected. Your breathing can be affected when you're sick because you're very weak, you're laying in bed. Your body isn't trying to make up for the utilization of oxygen, because when we're walking around, moving around, we require oxygen, and our brain tells body, breathe more, get more oxygen in. But in a situation where that's not happening, then you have to use oxygen from either an oxygen tank or an oxygen generating machine in order to keep your body going at a normal rate. So that's very important to know, very important. I don't know if that answers your question or not.
Yes. I'm just thinking, like, you know, because a lot of people have breathing problems, and then they end up using oxygen while they're still on treatment as well. So they've got a portable machine at home.
Well, I have to tell you that that is a very wonderful thing to have. But I also have to tell you that if the patient is not taught that they need to work on increasing their breathing volume, that is a mistake. And now they may have a problem where their lungs are not functioning very well, but a lot of times it's just lazy breath. I call it lazy breath. And if we have lazy breath, our O2 level will be lower. Now you can go to the drugstore and you can buy a little pulse oximeter. It's a thing that goes on your finger. When you go in the doctor, you see him do that. It will give you your oxygen level. It'll read the oxygen level in the blood, and it'll give you your pulse rate. So that can be a wonderful thing to have. And if it's too low, if it's not 98, then just start breathing. And if you have to breathe like a horse for a while, breathe like a horse for a while. And you can watch the numbers go up. We've got a lot of control over our bodies, but we need to know that we do. And we need to know that you can increase your oxygen levels just by breathing a little bit better. You know, if you want a breathing lesson, come down to Hyperbarics, and with love and gratitude and everything good, I will teach you all how to breathe better. Anytime you want to come down. It's not a big deal, but sometimes we don't know that, and we're lazy breathers, and we pay the price. Shouldn't have to do that. So go buy an oximeter. It couldn't be at Walmart's. It's probably the cheapest. You know, maybe $20 or so, and you can pay up to $200 for it. Same thing.
Yeah.
Okay, good.
We have a question for Jacqueline on Facebook Live saying, do you recommend having a hyperbaric oxygen treatment before or after a high-dose vitamin C treatment for treating cancer?
Before or after a high-dose treatment?
Yeah, vitamin C treatment for treating cancer.
I think probably the effectiveness, and depending upon dosage, you don't want to just go in the chamber and say you're going to do automatically 2 atmospheres or 1.5 atmospheres or 3 atmospheres or whatever. You have to kind of know how long you're going to be doing something, how long you're going to be doing oxygen, how long you're going to be doing whatever, and put it all together and make it make sense. Because you can't OD to the point it's going to hurt you, but you could OD to the point that it's gonna slow down what you're trying to speed up. Does that make sense to you? So it's good to talk to someone who understands the ratios, always. Okay, good. Anything else? Your examination will be tonight at 6 o'clock.
Just before dinner.
Amen. Well, anyway, you know, it's good to talk about what we're talking about right now, because we all need to know that oxygen is the most important thing in our life in terms of something that keeps us alive. And we need to have control over it. And our breathing gives us control over it. I can show you, if you bring me, well, you don't have to bring me, we have it at the downstairs, the oximeter, the little meter, and we'll take your level, and if we're not happy with it, I'll spend 15 minutes with you and show you how to breathe, and more often than not, you can make it work. You don't have to go find oxygen. Sometimes we're lazy breathers, see, but I can help you with all that. It's so easy. We just sit down and all the way in and all the way out. And if you get the oximeter on your finger, you're going to be able to know that you have control over your oxygen level. Isn't that exciting? It's monumental. Okay, good. Well, we made progress then, huh?
Good advice.
Amen. Good, good. So if you want to come in and want some more breathing lessons or some coaching, I'm cheap and easy for that. Any other questions? Okay. Well, it's been a great joy and pleasure. This has been good. So
We've got some more questions, Dr. Jolly.
we need to, yes.
We have more questions before you're signing off. We're almost there. My mom is currently at 2 atmospheres of hyperbaric at 50 G of vitamin C given. This would be their benefit. Would there be a benefit to having one of these first? Does that make sense at all?
Oh, in other words, one of the IVs first
Yep,
or the hyperbaric first?
yep.
You know, it doesn't really matter.
Doesn't really matter?
If you do it after, you're gonna probably get a little bit more benefit because you already have your body chemistry set up.
Okay.
But either way, it's better to do two things rather than one, especially things that are congruent with each other. But oxygen therapy is really one of the most important things, and that's why hospitals spend so much money. And when you go into the hospital room, you'll see every bed has an oxygen outlet. You know, it costs millions of dollars to put those in, millions of dollars, and that's how important they think it is. So if the patient needs oxygen, all you have to do is run in with the hose that has a built-in plug, shove it in, and put the mask on you. That's not a very dignified way of saying it, but that's what they do.
Okay. Thank you, Dr. Jolly.
Okay, did we do all right?
Yep.
Great.